piecemeal in it.
I voted for that.
We took some arm twister.
Oh, that's got some long memories, man.
Double screen.
That's mine. This is the people's business. All right.
Where's Tamika?
She's out. She's out today. Is she dialing in or no?
No, sir.
All right.
I didn't think she
we
could
expecting
get in.
Mr. McDowell.
I just saw him.
He's coming.
Oh, he's there. Okay. He's there.
No, I mean, I saw him.
Oh, you there at the funeral?
Yeah,
The funeral as well.
Oh, I didn't see him.
Said he's coming.
So, I don't know if you want to wait. We can try to call to get it.
Check on ETA. Let's get
Yeah.
ETA.
Okay.
He's 5 minutes. I don't see nothing too controversial tonight.
It's early yet.
Huh?
It's early yet.
It'll be a short meeting.
Madam, I see a few instances where we've got some proteges participating in some contracts.
Yes, sir.
Huh?
Sam doesn't want that money going up the interstate.
Oh. The protege, is there a protege-led project, Mr.
There-
Davis,
there
that you're
was-
asking about?
No, one was specifically going, listed as a protege. And a couple of others.
What numbers are you curious about?
No, I don't have any issues with them. I'm just saying, I was good to see,
Oh, did you want, you're
Some of
happy
the
to
money.
see the protege? Okay.
yeah.
I was getting confused for a minute because I thought that would make you happy to see the protege.
I'm gonna go down to Charleston and get me a one-room square footage. They can list me as a local.
We get it worked. Ed?
Less than 5 minutes, he said.
Let's wait for him to start. Let's wait for him to start.
Not bad.
You gotta pray for us.
Yeah, I know. I can't start without prayer anyway.
Tuna, fruit, plate.
We need to be giving some thought to, Daniel and I were just talking about, are we gonna meet on election day? Have we talked about that yet?
We did talk about it, yes, sir, but I'm not sure. I think it was during a subcommittee meeting, so I guess you're like, we ought to talk about it. What happened at the meeting? I'm sorry.
That discussion never happened then.
Your colleagues in the subcommittee felt the need to carry on, but I'm sure.
It'll be three.
Within the subcommittee, you can meet that day.
Well, we wouldn't meet based on our meetings. There's 3 more weeks left. It would be 5 weeks before we met then.
If you don't meet on November the 6th.
It's 3 more weeks in this month.
People can't
People
wait.
are safe.
People can't wait.
Yeah, that would put you at November 20th. If you,
Then we
unless
gotta
you,
quit for Christmas.
unless you
Work
go
session,
the
work
next
session,
week. I mean,
work session as
just the
well?
work session.
No, I'm saying work session as well.
I mean, that's That's what we had planned for.
I'd be interested in hearing what's most pressing. I'm sure there's some things that are time sensitive. Can we get a sense of what might be?
We can.
Well, when do we have the report from the planning commission? That's the rear.
That might be that meeting, right?
I don't know if it's that first or second meeting of November.
So,
Erica, do you remember?
I think it's first
The
meeting.
first meeting or the second meeting?
Haven't they already sent it out? They've already put it out, haven't they?
No, it hasn't come to us yet.
No, but it's coming. It's coming. That's
yes.
the first. I think it's the first Tuesday. The first Tuesday. So we'd certainly want to meet to handle that. But I'd be more inclined to do the evening meeting and not work session. I have the day free, but I'd be more interested in hearing what the workload is.
I know that the subcommittee pushed out the affordable housing incentive
Okay.
to work session so all of you could digest it and for a vote that evening was the direction.
Okay. Let's chat about it a little bit more. Well,
Okay.
fully constituted.
Oh,
I didn't hear you, but I assume you were speaking softly for a reason. So it's
Yeah.
All right. Okay.
yeah, that one is first.
Let's get a sense of.
We're here to serve, Mr. Mayor, whichever way y'all tell us to go. We will be prepared for you.
We need to be doing people's work.
Either way.
That's what an election's called. We got the right to the franchise. We got.
You can early vote.
Oh, I will early vote, but. Did we lose one?
We lost one.
Lost one, still waiting on one.
Shit. So that's what the real 5 minutes are.
Halen said if we can just get the schedule, the conference schedule, that we can get it. We can get it processed if we could just get the conference schedule.
Yeah, I get it. I got them somewhere in my drawer.
We'll work it on it.
Yeah, no
Thank you.
worries.
You're getting a lot of envelopes today. You're gonna be able to keep up.
Hey. Good. How you?
Yes, sir. Hanging in there.
I don't think I can go.
You gotta do more than hang.
I don't know what we're saying. He was waiting on you.
Hello.
Did you take care of Joe Rosen yesterday?
Yeah, doing that. Erica's,
I think Missy wants to move for office from next to mine.
1206.
I don't think she wants to be next to me anymore.
Really? I thought she had gotten used to it now.
Oh, you're never there.
We had a discussion several years
You ain't
ago.
never there. That's the best office.
But I am there.
You made up for lost time.
It was,
All right, so anyone got eyes on Mr. Davis?
Yeah, it's like,
He's here. Mess. How you doing, preacher?
I did talk to,
Thank you.
you get my,
Yeah, I did. Thank you very much.
he understood that.
I know a couple of these are nuanced because y'all are talking about regional.
We do it then.
Yeah, look at what Don Gone. Those are the ones that are coming out. Those are the ones that's going to go out the next day. So maybe look at something on that list. I think one Daniel wanted District 4. I forget what it was. And there was another one.
For what?
Just the boards of commissions.
Yeah, no, I've got two people I'm meeting with for, the housing authority. And then I gotta find a planner. So- Huh? Who?
Incumbent.
You look,
We don't
no,
have
sir.
anybody from District
No,
Four.
District 4. We do have an incumbent eligible for reappointment.
I thought we ended up with two. 'Cause some,
Only been there for 30 years.
Who's that?
No. He
Talking about
goes- he's
CHA?
got- he's- yeah, we need, no.
oh yeah, I love her, but
What do you mean you got for the housing authority?
I'm going to interview two people.
That's the one eligible
Two,
for reappointment.
two ladies, one who's a retired attorney.
Come on, Sam. You go to the reporters luncheon? Where'd you go? I'm messing with you, I know, man.
Did y'all see that this morning? The, customs agent in Atlanta, what they found in the luggage. Somebody brought over a whole roasted pig.
Big head.
Yeah, like 2 pounds big head of roasted luggage.
I read that last night and I said, I got to.
Yeah, it was wrapped up in aluminum foil.
All right, Madam Clerk, could you please call the roll?
I am here.
Yes.
Present.
Here.
Here. Ms. Dow, would you bless us with a word?
Yes. Lord, in the providence of your promises, you've allowed us to gather around this table to discuss matters of our city as we continue to expand its horizon. Touch and ignite us with promises of grace, love, and sensitivity. We ask it in your name.
Amen.
Amen.
Madam City Manager, how are you?
Yes, sir. I'm doing well, Mr. Mayor, and all of our gentlemen on council today. It's Happy Bosses Day for me. I didn't know it was Bosses Day,
I
so
didn't even tell Satasha with balloons.
yeah,
on it, so,
everybody's
yeah.
been really nice. So Happy Bosses Day to our gentlemen on council. We will get started with
Is
city.
that it?
That's it. Oh, do y'all like treats? I'm sorry.
I'm just
Coming in handed. Look, before the end of the day, we usually end up with lots of sweets and all kinds of
Alicia's
stuff.
gonna start walking stuff in. Thank everyone for working around our schedules as we paid our respects to the Lindsay family today as well.
Beautiful service for a very nice man. We have our first city council discussion item is a state health plan update. So we've been working hard to get ready to transition with all of our employees to the state health plan as you all have directed, and we need to bring you an update. Ms. Pamela Benjamin, our Chief of Staff and Human Resources Director, will take you through some information. And hopefully this will also serve as additional notification. We're going to talk about it a little bit this evening too, so that staff members, retirees will, we put it out there. We want to make sure everybody knows what's entailed. It's going to be a little bit busy over the next few months to get this done.
Right, so good afternoon. As Ms. Wilson has stated, we have been vigorously working on the transition. It's been interesting because there's a lot of things that have come up that we hadn't thought about. And it's just transitioning into going into the state health plan because a lot of you have a lot of people have spouses that are on it. A lot of people, we have retirees that are on it, and it's going to affect people in different ways. So we've been working really hard on that. But I wanted to start the stage with kind of a review of where we left off the last time. Of course, you all know that nationally healthcare costs are skyrocketing all the time and going up, and we are certainly not immune to that. So we were looking at some projected healthcare claims going up to 32 million. I think we're around 25 million is what we're projected at spending for this year, actually, and that 32 million was showing some growth over the future years, and a huge OPEB liability. And so in order to kind of put some restraints on that and figure out some other options, we looked at the state health plan as an option for us to consider going to. And so that's, again, some overview of what we've already discussed prior. So as you guys know, the state health plan, the reason why we explored that option was it's a similar network with similar benefits. It's certainly a recruiting and retention tool in the sense that other agencies and other municipalities around the state are members of the state health plan, which will make it easy for us to have candidates from those different jurisdictions and those different agencies come to work for us because they'll be able to maintain that same healthcare system. We certainly are looking for some savings at the city with going to the state health plan. And so we definitely explored looking at that and seeing how much those costs would be fixed as opposed to those continuing claims that we had no idea what those claims would look like as the future moved on. So we certainly were looking at, as you all will remember, not providing health care to some of our populations. But now, looking at this option, it allows us to still provide health care to our active employees, their dependents, our pre-65 retirees, dependents, and our post-65 retirees and their dependents. As you all know, we will be locked in for 4 years because that's a part of the plan once you sign up. And also, you'll see that they have several different plans that are available: standard savings, TRICARE supplement, and Medicare supplement for retirees. In addition, we will not be charged an experience rate for the coming year, but after that, we will be assessed that experience rate, and so we'll have to look at that, and I'll talk a little bit more about that when we get to the premium portion. I did want to mention that individual participants may see some changes in their experience because maybe the co-pays will be different, the cost shares will be different on some of the services they receive from the plan we had previously. So I did want to mention that just because, no, you can't make everybody happy, so somebody's going to have an experience that, may be changing. Maybe their prescription costs different on our plan than it will on a new plan. We're hoping, and we did a little comparison, so that should be quite similar. But there may be an occasional thing that's different for our individual retirees and employees. So we wanted you to be aware of that. So as you know, the state health plan offers a lot of different coverages to active employees, retirees, survivors, and dependents. A lot of us know people who are on the state health plan, and so they cover 500,000 lives, and about 709 entities are underneath the state health plan. Be that school districts, state agencies, local subdivisions such as ourselves, municipalities and counties, and special purpose districts. And since 1985, the General Assembly has allowed local subdivisions such as ourselves to join the state health plan. So this is a list of the benefits that we have to provide once we go to the state health plan. And you'll see there are 3 columns there. The full-time employees, there's a list of those coverages we have to provide, the retirees and survivors and COBRA participants. So you'll see some additional insurances that have to be provided that we weren't providing previously. Specifically, we were not providing a basic life and an optional life and dependent life. We did provide that through Colonial Life. It was an optional choice for people. It'll still be optional, but it'll be provided through the state health plan. They also have a dental plus, vision, basic life, basic long-term disability, supplemental long-term disability. Money Plus is similar to our flex spending account, so that's going to be a similar benefit that we provide in the vision care discount program. So those are the things that we have to provide. We can't pick and choose. We can't decide we want to do some and not others. We have to provide that whole suite of benefit coverages. Does anybody have any questions about that?
So when you say we have to supply, we have to offer.
We have to offer.
Right. 'Cause you're not obligating everybody to take everything.
Absolutely. You're not obligated to take any of these, but we have to offer them because it's part of their package.
So another option then, I'm sorry, Sam.
Go ahead.
Go ahead.
Just one quick question. You mentioned suite, retirees and survivors, that category. It has to come as a package, or can you just go with vision and dental?
Yes, sir. You can pick just vision and dental, but we have to offer all of those to our retirees as well. But again, it's optional. You can decline all the coverages if you choose to do so, or you can pick whichever ones that best meet your medical needs.
Now, is the life insurance optional?
Yes, sir. It's optional as well.
So if you buy
Now-
into, I'm sorry.
Now, I will say, thank you for mentioning that. If you get the health insurance with state health plan, you automatically get a $3,000 life insurance that comes along with it free of charge. So that is offered. But you can get some additional basic life insurance. And there's a tier depending on your age and the level of coverage that you want, level of life insurance that you want. So those premiums are based on age and how much life insurance you want to take out for yourself or your dependent children.
So the difference between optional life and dependent life is?
So the basic life is for the individual themselves.
Okay.
The dependent life insurance would be for a spouse and their dependent children. Okay?
Thank you.
Certainly. So those are those options. So, as you all will remember, back, when was it? I can't remember when we had that council meeting, but you all approved us to go to the state health plan, and we got our application approved by PIBA. And so we are definitely moving in that direction come January 1st, 2019. We have begun to send out emails and communication to our employees. We are in the process of sending out a mailer to our retirees that'll have a booklet for them to review, and it'll also have a list of premiums and a welcome letter attached to it. So we're sending that out. Hopefully, we're going to send that out at the end of this week or the first of next week. So that's what we're trying to do. We will be having group enrollment sessions starting in November, and those will be to enroll everybody to go live with the state health plan in January 1st of 2019. Those group enrolling meetings are extremely important. I'll talk about that in a second. So let's look at the premiums. Of course, everybody wants to know how much it's going to cost us. So this is a list of the premiums for active employees, and I've broke them down by our pay periods. So this is what an active employee would be paying every pay period for insurance, either standard, savings, or the TRICARE supplement. And then you'll see the tiers for the employee, employee spouse, employee children, and the full family. So those are the paycheck amounts that they'll pay. I put the monthly amounts when I sent out the email, and everybody panicked. Everybody was like, "Oh my God, look at these rates!" I was like, "No, I didn't divide them by 26 pay periods, so I've done that on this chart so you can see that. So those are the vision charges, the basic dental, and dental plus. And again, the vision and the dental plus, you can get the health insurance, but not the vision or the dental if you choose. Does anybody have any questions about that? So these premiums are based on PIBA's premiums. They set the premiums, and we are required to pay whatever PIBA sets as the premiums for active employees every year. So these are the premiums that they've set for this year. As I understand it, these are the same premiums they had last year. So 2019, there will not be any increase in the premiums from what they had in 2018. So these are the same premiums. But if in 2020, PIBA decides to increase the premiums, we'll have to increase our premiums that we charge our employees, because PIBA sets the premiums for the active.
So you no longer have a choice of upgrading your plan. You just, it is what it is.
Right. We are a member of the state health plan, and it is.
No, you're asking upgrading your plan, you said?
Remember, you had a choice
Right.
last time.
He's asking about
As
the
far
difference
as the
between
coverage?
standard and savings, I think.
Is that what you're asking about?
In the city, or you mean the
Councilman Rickman?
individual?
As, well, we offered multiple tiers last time, so you could,
So we had three plan options.
Right.
The base, the core, and the buy-up.
right.
And so they offer the
Buy-up, that
standard
was
plan
one.
and the savings plan. So you'd have to choose again between the standard plan and the savings plan. But if in one year you chose the savings plan and then the next year you want to go up to the standard, you'd be able to change during the open enrollment period.
So people have choices.
Right, they have those standard plan or the savings plan are the two choices.
TRICARE is just, it goes along for the military,
Right.
right?
Right. The
I know
TRICARE
we-
supplement is only a supplement if you are a former military and you have TRICARE through the military.
How many do we have on track?
Not many. I would
That's
say
close.
probably
That's close enough.
20. I mean, we have very few people on TRICARE. Yeah. Right. We don't supplement TRICARE now. So currently, if they wanted to get our coverage, they could and not use TRICARE. That would be an option available to them. And they don't have to take out the TRICARE supplement if they don't want to. That'll be their choice as well.
Pam, just based off your, cursory look at the plans, does standard more correlate to our current buy-up? Or, is there a correlation you can make between, say, with savings and standard versus our three plans we currently have?
I would say that standard is kind of in between our core and our buy-up. Because we have been lucky and we've been very generous. So we've offered our buy-up plan was a little bit richer than the savings plan. Than the standard plan, but it's real close. It's very close to our buy-up plan. So we're anticipating that most employees will go to the standard plan because most of our employees are in the buy-up plan now. So that's what our anticipation is. We're hoping that the savings plan, that people that choose that plan are going to be those people who are very healthy, people who are very good at saving their money because the deductible is quite high. And so if people are attracted to that small premium, then they got to know that with that comes some responsibility on their part, that they have to save money and they have to be able to meet that deductible.
Explain that in the enrolling process.
Absolutely. So that is one of the things that we've emphasized to the PIPA enrollment people, is that when you give our educational presentations to our staff, that you please go over that clearly, so they really understand that.
How does that $45 a month, a paycheck, compare to what they're paying now?
Well, of course, it depended on what they were,
Let's say the buy-up.
what coverage they had. So, I got my little handy dandy premium chart here. And it's so dark in here, I can't see.
It's the lights. I thought it was me.
It's very comfortable.
I know, it's
Calming.
comfortable. So we were charging, they were paying, $132.50 a month for employee only buy-up. So
132 times 12 divided by,
y'all gonna make me do some math. Yeah. 130,
Daniel figured that out in his head.
Daniel, figure it out. 132.50 times 12 divided by 26.
What do you want?
You can do it.
132
132.50 times 12 divided by 26 pay periods.
That was the buy-up.
132.
What?
132.50.
What'd you say? You wanted 132 times 12, which is 1584, and divide that
Divided by
26, $60.92.
So that's a little cheaper.
So they were paying $60.92, and now the closest to our plan would be $45.08 for
Just the employee.
just the employee. Now, of course, you remember that when we were looking at the possibility of keeping our plan and being self-insured, we looked at changing our premiums for everybody. So our premiums for our active employees would have been higher next year if we had to stay with a self-insured plan.
So
I don't
what?
have that with
So
me.
these are the employee premiums. What's our actual premium cost by the switch? Yeah. What's our,
entire-
I mean, at
you
the end
looking
of the
at the
day,
entire
the whole
premium?
idea was to provide a plan that was sustainable, but at the same time, we had the ability to protect ourselves.
You can look at the Cobra cost and tell what the premium is.
Yeah, that's really, because you would have to pay all of it, but I don't know that I have that with me. You got it, Missy?
So what's the math? And what does that do to our actuarial?
Next actuarial becomes June, so, discussions that we've had with them is that we'll lower it.
Where does it cap us out? Where does our liability cap out on this? I mean, you know, because the state could turn around and have massive issues and we end up back to where we are. What's our,
Well, there is no cap. If the state raises this, that changes our study. That's just, I don't know what can happen. You know, if they turn around and double the premiums to what the contribution from the city
well,
is,
the beauty part, I'm not worried about that because they'd have a riot on their hand and they have a lot more employees than we do, so we know that's not a reality, but just trying to understand how, because part of the whole purpose of us going to it is trying to find a plan that was sustainable, one that was an easy for a transition, and then the third piece was capping our long-term
Less
liability.
liability.
so the long-term liability as of June 30 is $168 million under the calculations under GASB 75. I say 168, it might be 160.
You like that number.
So
That number
that's
comes
a
up a
good
lot with you.
number, and our total, that was based upon last year's costs. Our overall costs are coming down, so that should bring the liability down. But we're still working with the actuarial to get a study, or at least to get an estimate, because the actual study itself won't be due until next June, and it will change. The problem that we're gonna have in comparisons to prior years is we changed from the calculation as GASB 45 now to 75, and it changed the way the calculation is done, and there's a lot more volatility in what that number is based on, because it used to be you would set a discount rate of, say, 4.5%, you just use that same 4.5% every year. The issue we have now is we do the calculation annually instead of every 2 years, and there is no set discount rate. The discount rate will now be pegged to I think it's the 20-year MMD rate. So there's volatility in that rate, and that causes volatility every year. Even if we had the exact same experience numbers, it will change the liability over the next 30 years based upon that discount rate. So what I anticipate happening is, over the next several years, we're going to see interest rates going up. It's an inverse relationship to our liability here, so it's actually going to help our liability and bring it down. The example would be at the beginning of the past year under GASB 75.
45.
When we did our calculation, you do a calculation as of January, or the beginning of the fiscal year and the end of the fiscal year. So at the beginning of the fiscal year, when we did the calculation, we had a little bit lower discount rate, and that's where I came up with that $168 million liability. Because there is a slight increase in the discount rate based upon the June 30 number of the MMD 20-year, it actually improved our position by $4 million when we dropped from 168 to 164, even though you're looking at everything else stayed the same. Going forward, I don't think anyone anticipates the Federal Reserve is not going to be lowering rates anytime soon. It appears they're going to continue to increase rates, so that's actually going to have a positive effect, at least for the next several years, on our liability. So what I'm getting around to saying is we anticipate the liability being lower because we've improved what our total costs are. We're spending less per retiree discount rate is going to be increasing over the next several years. So that's going to have inverse effect and bring down the liability as well. So we're anticipating that to be an improvement in our liability. But I'm telling y'all this still, by the time the numbers are done next June 30, there's no guarantee. Should the economy crash in the next 6 months and they have to lower rates again, that can have a dramatic effect as well. But there's a whole lot of other issues
So-
with that occurs.
So saying that though, and I think this is very important, and I'd like us to figure out the calculation, because the one thing that we've never done with our employees is actually show them the true value of the health care. Because we are supplementing families and dependents both in the retirement and in active. And that's never been calculated. And I had this discussion with an employee the other day, and I think they finally realized, wait a minute, I've been calculating
Comparatively.
everything incorrectly, because we do supplement and a lot of people don't, and I think that's something that with this plan we're able to maintain. Looks like we'll somewhat levelize out our long-term liability, which I think then we've achieved partial of what we tried to get done without disrupting the whole process.
I thought we,
Can I add one more thing to that? Since I said that number was
Can you do it under 30 seconds?
I can.
I'm just kidding.
That's such a large number, I want everyone to understand. When we did the estimates before making changes, if we had continued to do what we were doing for the past several years, the estimated new liability was going to be
300 million.
$301
Yeah, 300 million.
Right.
versus 168, and by 2047, that liability
It was
was
a
going to be
billion.
in excess of $1 billion.
Yeah.
So no, it's a significant.
Well, we wouldn't have.
What
we
was
wouldn't
the,
have-
I'm sorry, Sam, you had a question.
Go ahead.
What does that, turn out, ARC to? What does it look like?
So,
You knew it was coming, so.
So, because they've changed the way the calculation's done, we don't book a liability on an annual basis where it just grows each year.
Okay.
That was the number where we were growing, we were up to like 55 million. We had that annual required contribution listed there. Under the new calculations, there's not an arc. So that's one of the additional things. We're kind of going to split year between year ends. I know everything.
I'm smiling, no, is that?
No, you
Is that,
can't
is that, a,
get
is, that,
$55 million.
is that a good thing? I'm listening.
We're not building
I
any
don't-
garages.
That's one of the things with the new calculations that Deanna and I talked about this morning. We're going to there's some additional discussions coming up when Aon, Eric, y'all met Eric Atwater several times, has been up here. That's some of the things we're discussing with him. So when we come back later this year talking about the OPEB liability, that'll be one of the things we'll talk about is what do you put aside?
Yeah.
Because I don't have the same, it's just not the same, it's a totally different type of calculation. We have now recognized the full liability on our balance sheet starting this year. Well, actually, the end of this past year, June 30. That whole 168 million is now on the balance sheet. It used to be it was only the 55 million that we had roughly 55 million in the bank. And then every year you would just put a slice on until you build up to the 30-year liability.
I'm interested in hearing the answer to that question, but so shouldn't that improve our cash flow? I guess depends on what he says. Okay, depends on what. What's that?
Technically, yes, you're correct.
Should
It
improve
could.
It should.
significantly.
So Missy passed out a sheet, because like you were saying, Councilman Rickman, we always pay above what the employee's premium
Well, I
is.
just think people need to know what the
And we,
value
we
is.
certainly try to communicate that to our employees, but we certainly will we'll do that again. But that list that she's given you shows you what the total premium, the total amount that we have to pay PIBA. If you look at the employee only for the health, it's $374.96.
Yeah, I mean, a
For an
full
employee.
family's $929.
Right, the full family's
And we're
$929.
paying, and the employee pays $281 out of that, so it's still a $650 swing
Right.
a month. So,
A month.
I mean, I think it's important people to understand where all our costs, which is a reduction of what we had before.
That is correct.
When you looked at what we were looking at, like you were asking about how we pay on like more of an annualized basis, we looked at just what our healthcare costs was. Before going to state plan departments, we were having departments budget about $13,000 per employee. And that's just for healthcare costs, that's not the liability costs that Jeff was talking about. So now we're down close to 11,000 per employee.
And the other thing you do have to keep in mind also is that we would have to pay those claims on top of just providing that coverage. So whatever those claim costs would be, we would have to pay those costs as well. So that
Have we ever shown, maybe a chart or something, Pam, at the time that employees are signing up for, healthcare and choosing which plan? Cause I'm just sitting here thinking about that too. I don't know that there has been a time where that's really been made clear. I think we say it. I don't know if they ever see it. I don't think they've ever seen the difference in that number.
It's a significant contribution, so I mean, I think, for us to be able to further a plan that's a quality plan, sustainable, number one, which is very important, and provide both those, everybody who's in the system a plan is, I think, pretty significant.
Maybe we can do some laminated charts, that's when people are signing up and just not, they have to take it, but show them the math.
What the actual healthcare cost is. I think it's important that people know.
Right. I thought
A
we
lot of
did
people
that.
don't,
we could certainly do that. So those are the active employee premiums that we have. Again, like I said before, those are set by PIBA. And so we have to charge our employees that cost, because those are the costs that PIBA charges. The retirees, on the other hand, we'll talk about those right now. So retiree eligibility. So this is an important slide, important thing to think about. PIBA determines retiree eligibility. The City of Columbia won't be determining retirement eligibility. It'll be PIBA. They will base their determination on your years of service that you've contributed to the state retirement system, whether that be in the police officer retirement system or the regular state retirement system. So they will be making those determinations. If it's determined that you are eligible, then the next question is going to be, did you retire from the city with city health insurance benefits? And if the answer is yes, then you are potentially eligible for a subsidy. If it's no, then you'll be assessed the full unsubsidized rate. And I'm going to talk about that a little bit further. And if no, then you won't be eligible for retiree health insurance. Because with us going to the state health plan, we have to reach out to everybody who was ever employed with the city, and we may be obligated to offer coverage to a lot of people that we haven't previously offered coverage to. And so because of that, and because of the potential to increase those costs associated with adding all those new people on the plan, we've looked at the options that I'm going to show you right now. So as I said before, eligibility is determined by PIBA. What they look at is if you left employment after reaching service or disability retirement eligibility, and you have to have at least 5 years of consecutive full-time employment with a covered entity, and then you'll be eligible for the coverage. Now, as you all know, with us being a local subdivision, we have the opportunity or the option to charge those retirees whatever premiums we want to charge them. So because we're a local sub, we're not bound by PIBA in any way for those premiums. So we can offset those costs however we choose. So number one, if you're eligible, if you've left employment, you've retired, had at least 5 years consecutive full-time permanent employment, then you may be eligible. If you left employment before reaching retirement eligibility, if you have less than 20 years, then you're not going to be eligible for PIBA insurance. So you wouldn't be eligible for PIBA insurance, and we wouldn't have to offer you insurance if you did not work at least 20 years in a PIBA-covered entity. If you work 20 or more years, then you, again, depending on what this local sub, us, decides to charge that retiree, then we'd be able to charge that cost. So does everybody kind of understand the way that chart works?
We're
Which-
grandfathered in with the 5 year,
Yes, sir.
so the 5 year doesn't apply.
So the 5 year does apply to us. So our employees have to have served 5 years with us.
With us.
Right. So let's look at this a little bit more.
So, just to clarify, I mean, we had changed our retirement to, right, so it's actually reverting back to less now.
Well, let me show you the next slide. So if you look at the next slide, so as a participating local subdivision, the city is required to provide access to the insurance coverage. But we also have the ability to determine premiums. So the city will be subsidizing those retirees that were previously covered under the city's health insurance program. So any current retirees we have on our retiree insurance, we're gonna subsidize those individuals. So let's look at this a little bit more. A retiree is eligible for the city subsidy and will pay the subsidized premiums if they were a PIBA retiree and they were covered under the city's health insurance as of 12/31/2018. So those are any current employees we have who are going to retire, say at the end of the year. They were on our coverage. They had that 5 years, like we mentioned before. Then they would be eligible for the subsidy. Then you look at those, as you were talking about, Councilman Rickman, those retirement insurance eligibility thresholds that we set.
So it doesn't change the 2009, which is
Right.
what our
So individuals who were employed prior to 6/30/2009 and had 20 years of service, they'll be able to pay the subsidized amount. And then individuals who were employed after 7/1/2009, they have to have that 25
Which
or
is
that
what our
28
current
years,
is.
which is what our current one is. Then they will be eligible for the subsidized premiums. Those retirees that weren't with us and they only worked for the city for the last 5 years of state retirement and they did not meet those prior eligibility rules, then they will not get that subsidized premium. They'll have to pay the unsubsidized premium. So we looked at that in terms of, I don't want to say rewarding, but those people who have been with us for their career, then they get to be subsidized. Those people who we have to offer coverage to, they work for us. Say they work for us for 20 years, they left and went and worked for Department of Revenue for 3 years. And because of their situation, they're eligible for retirement, then they would have to pay the unsubsidized amount. So that's what we looked at. So turn to the next page so you can actually see the premiums. So if you look at the top, you'll notice that those premiums with the subsidy for our pre-65 are the same premiums that our active employees are paying. So I put monthly rates on here because that was a better comparison for this particular chart. So those are the rates that our active employees are paying now if you're subsidized for the pre-65. And if you look at the chart underneath that, you'll see that those are the rates without the subsidy. So for example, an employee or a retiree with the subsidy would pay $97.68 for the standard plan for themselves. If they were not receiving that subsidy from us, they'd have to pay $500.38 a month for that coverage. So that's what those rates are looking like. For the post-65, the Medicare supplement, you'll see that it's $200.38 for a person with the subsidy. Without the subsidy, it's the $500.38. So you'll see that there's quite a bit of difference between those rates. What we're anticipating is that people who already have coverage will maintain the coverage that they have, but if they want to have access to the coverage, then those are the premiums that they'll be required to pay. Again, premiums will be subject to change every year. We'll be able to evaluate how this is working. We'll be able to determine what our experience rate looks like because, of course, we're anticipating if we add new people onto the plan, it might affect our experience rate in the future. And you'll know, and as we said before, that experience rate will take into effect after we're on the plan for a year. So it's really the second year after we've been on the plan.
24 months from now.
That's right.
We'll know. So
We'll know. And it'll be based on the claims that our population has.
Which brings up, is there any incentive, is there any programs for, encouragement of getting your, yearly physical, health programs, smokers? What are all those details?
So they do have, some wellness incentives, some wellness plans that they encourage employees to take advantage of. And we'll be giving all of our employees this little booklet, and it's got those wellness programs outlined. And I'll get you guys one of these too, because you'll be on the plan, so you'll see what it looks like. But they are encouraged to get their, their wellness checkups. Those are covered now where they weren't covered previously through PIBA. So those are covered now. So that's one of the things that they've instituted for coming up in year 2019 that wasn't covered before. They don't have the same type of plan that we had before where we would pay people for doing those things. And our wellness incentive program, they don't have, it's not quite that, aggressive, generous, but they do have some wellness incentives that are built in. Again, with healthcare coaching is a big one, and having those wellness visits. So that's a
from the
part of the plan.
healthcare coaching side, I mean, one of the things that we've seen historically in the city is employees not taking care of themselves, and obviously we want to encourage their health for their longevity, for as long, as they're meant to be here. But, I want to make sure that there's something there, or we need to figure out, we need to have a red flag system because we need to encourage people to take care of themselves.
Mm-hmm.
I think since we really pushed that over the last years, it's somewhat got better, but still not to where it needs to be.
Absolutely. But they have several preventative screening programs. They offer for free flu vaccinations, wellness checkups. They have a suite of things that they offer and encourage employees to take advantage of. And again, some of it's a little more passive than some of the things we were doing, but they still have ways to encourage that. Worksite screenings, those types of
How will
things.
we get that message out so that our folks can take advantage of that?
So there'll be multiple ways. Of course, they are participants in the rally, which is a service you sign up for, and it helps you track your wellness activities. We will have the opportunity to do work site screenings. They'll have mailers and flyers and things that they send out in email blasts. So it'll be some of the similar ways that we've tried to communicate with employees in the past. A discussion we will need to have in executive session is whether or not we're going to maintain our employee health center or not. That's a big question we're being asked. There's definitely some advantages to that. But
How will that? Well, I guess we need to understand how that would integrate with this plan.
Honestly, Councilman recommend it would be a separate thing that we just are paying for our employees. It'll be a benefit that we offer. It really doesn't integrate.
Cost change? Is it cost change?
Yeah.
We'll talk about it. Okay.
Yeah.
Let's keep on trying.
So but we'll talk about that a little bit later. So does everybody kind of see how that works? So again, your eligibility will be determined by PIBA. If you are a retiree that's eligible for insurance, then you'll be able to possibly get the subsidy depending on your years of service with the city.
We'll have to contact everybody that's retired and still alive from the city.
Yes, sir. So PIBA has run us a spreadsheet of all of those employees, of all those retirees. It's around 1,500. And so we're mailing them booklets and premium sheets and welcome letters. And we're going to have some new group enrollment meetings. We're going to have 2 that are specific to retirees on the 5th and on the 20th at Earlwood Park. We're inviting retirees specifically to those meetings because the benefits are a little bit different, and they really want to separate the 2 groups so that they can make sure that they give good service to our retirees. But we're reaching out, we're communicating with them. Those meetings will start November 1st, and they'll last through the whole month of November. We're working on a schedule right now for designated dates for individual departments. So I'm getting that together now, and we'll send that out. Hopefully I'll send that out on Monday because I'm just getting back contacts with the departments. Again, we'll send something out to the retirees, a mailer, telling them when the open enrollment dates are and telling them that they need to be there. And the new group enrollment will be mandatory. If you don't sign up, you won't have coverage. And it's really not that complicated. We will have a lot less control over the plan than we did before. So we're working with PIBA. And so it'll be very important that everybody come, everybody hears the educational sessions. They're going to be 2-hour sessions. So a majority of that time will be them explaining the benefits.
Can we get a service to come in and help our employees?
No. PIBA has to do our new group enrollment themselves.
Is there,
So-
is there any additional education or information we can continue to push out as well?
Yeah, so we've got these booklets that are going to every employee. We've got booklets for retirees that are going in the mail to them. We're sending out emails, we're putting things on our intranet, we're putting things on our employee online where employees see their paychecks. And so we're doing a lot of things to push out this communication to everybody. Another thing about the enrollment meetings is it's going to be important that people bring all their documentation to those enrollment meetings. So if you want to add a spouse or you want to add children, you got to have your marriage license, you got to have birth certificates, you got to have copies of those documents in order for people to retain them. They'll keep them, they'll scan them, and they'll have them associated with your file. So that's going to be really important. And individuals with Medicare, they'll have to bring their Medicare cards with them in order to enroll during the new group enrollments. So I put this slide in here because I want everybody to see that because that's really important. Because if you don't, you can enroll yourself, but you're not going to be able to enroll your dependents. And then if you miss our time frames, you're going to be not able to enroll them until the next open enrollment, which will be in October. So everybody got to be big boys and big girls and be responsible and do what they're supposed to do.
We're gonna have to utilize department heads too to really insist and
Yeah.
set
And
up
we've-
time, especially with our police, fire,
Mm-hmm.
public works, and those staff members are in the field a lot. We're gonna have to figure out ways to get them in, get
Absolutely.
it done.
So we already have, for example, Public Works is typically off on Wednesdays. We're scheduling 2 Wednesdays, and they're bringing their employees in to do their enrollments during those Wednesdays. Police and Fire, we're working with their chiefs in order to have late sessions or early sessions to make sure they can get in there to do their enrollments. And we've got several different locations identified to do those enrollments at. So it's going to be real important. The last thing I have on here is that you all know, like I mentioned before, the Wellness Incentive Program, where you got $75 for doing those wellness activities. We're not going to be able to maintain that program because it's going to be too costly. And frankly, as 3 of us in this room are doing it, most people aren't doing it anyway. So it's not really worth the money that it costs to hire somebody to manage those funds for us. So we're eliminating that program. Everybody's going to have to use that money by the end of the year. It's going to zero out and it's going to be gone. So we're making sure that people are aware of that. So everybody who has that little white card and has done either a preventative checkup, they've done the biometric screening, they've answered the questionnaire online, or they've got a health coach that they've reached out to for a chronic disease, then they have $75. So everybody got to check their balance and use their money. Because it's just not cost effective to continue that program. Does anybody have any questions about any of that? But we will definitely make sure we have those full premiums. Like you said, Ms. Wilson, either on something laminated or something we can provide to employees so they can see the full cost. We're going to continue through this month and all of next month communicating, making sure people are aware of what needs to happen. We'll certainly have Erica will attach this presentation with the minutes, and we'll make sure it gets out to all of our employees as well. So,
Thank you,
any
Pam.
questions? That's it.
Questions for Pam?
Nope, I'm good.
I meant to, and I failed to do so at the beginning of the meeting, introduce one of our newest employees. I know Pam may want to add a few words, but we have hired our court administrator, Mr. John Stewart. And John is on day 2. I was like, you're still here, right, John?
I got my computer to print this morning.
Okay.
Well, maybe you'll get your emails by tomorrow.
Yeah.
So we're really thankful to have him. And Pam, did you want to add anything about Mr. Stewart's background? Or you can tell the council yourself, John.
Okay, it's a privilege to be back at City of Columbia. Right out of college, I worked at Columbia Police Department for 2 years, so my employee number was 4 digits, I remember that. But I've worked in virtually all areas of the criminal justice field, and to make it full circle, I'm back at the City of Columbia. I'm already working with the stakeholders in the court system. I have a meeting with Chief Holbrook tomorrow, and we're going to look at systems. Systems in some areas are broken. We're going to fix it. We have a large backlog, and that's one of the top priorities. And we're going to look at technology too. One of my previous jobs, I wrote federal grants, and I foresee us applying federal grants for the court section. So I'm anxious to get started.
Where are you most immediately for?
Solicitor's office next door. Thank you.
Welcome, welcome.
Thank you, John. Our next item is Ms. Melissa Lindler, our Director of Office of Business Opportunities, to give an update on the Commercial Revolving Loan Fund and the proposed code revisions.
Good afternoon. I think mine may be a happier topic, right? Let's hope. What we're going to discuss today are some proposed revisions that are needed with our Commercial Revolving Loan Code. The revisions are necessary because of recent amendments that were made to our Economic Development Administration, EDA, regulations in January of this year.
I had to redeem myself. Y'all checked me real quick that we don't say Happy Boss's Day without some treats. So thank you, Shalane.
You're welcome. Right on time.
Right on time.
As most of you know, the EDA, Commercial Revolving Loan Fund, the purpose of this fund is to provide or foster economic development and job creation in our community in the city of Columbia. These funds are available. It's one of 3 commercial revolving loan funds that our office actually administers. The other 2 are our Columbia Economic Renaissance Fund and our Community Development Block Grant Funds. The EDA funds, the purpose of this fund is to provide gap financing, and it does require bank participation. We've actually administered this fund since 1987. So we've had these dollars for a very, very long time. As many of you may remember, our funds were sequestered back in 2012, but it was released in 2014. And as of 2015, between 2015 and 2018, we have made 10 loan applications or have been approved and funded in the amount of $1,449,500. Our current available balance is $348,870.66. Thank you, Tanya. She loves numbers.
And all of those are current,
Those are current numbers.
currently paying back into
Yes.
the
Well,
fund?
they are. They're active loans. They're active loans. We are going to have an overview of all of our commercial revolving loan funds at a later date this year, where we'll provide an update not only on EDA, but also on our SURF dollars, as well as our community development block grant funds. We want that to be a very comprehensive review. This particular presentation is really to focus on the proposed changes needed within our code so that we can actually make the modifications to our EDA plan that's due to the Economic Development Administration. As I stated, the EDA regulation amendments were actually implemented in January of this year. 3 significant changes that you're going to see as you look through the code revisions that I provided to you in the memo. One of the main ones that you're going to see a lot of changes with reference to the expanded list of public sources that can be used as the leverage when it comes to meeting our 2-to-1 leverage requirement. Prior to the amendment, the only federal funds that could be used, or public funds that could be used, were SBA 504 funds or 7A funds. With the change amendments with the changed regulations that were made, this now includes any federal, state, or public funds. We can use any types of public funds to meet that requirement, that 2-to-1 leverage requirement, which is really significant. The next change that you'll see is the EDA RLF cash used to buy out the first position in a loan must receive EDA approval before taking such action. It no longer requires that we have an 18-month turnaround time. It actually means that we just need a reasonable time approved by EDA to make that change. So that's new. Now, another very, very, very big significant,
So, Melissa,
yes,
so the
sir.
turnaround time lessens,
It actually just depends on how much time EDA gives us. Before it was 18 months, that was the requirement, it was 18 months. But now it could be more than or less than, just depends on the circumstances regarding each request. Makes sense. The other big change that was made is the implementation of the EDA RLF Risk Analysis System, RAS system. This is very, very new, and our initial rating, all of the RLF recipients received an initial rating, but it was based on your last 6 months reporting period ending on March 31st, 2018. I must say, I was only here for 3 months when we did this report, so I cannot take full credit or really any credit for what we did. I will say, though, based on the following categories: our assets, our management, our capital, our liquidity, our strategic results, our earnings, our rating was A. We received an A rating, which is significant. In the Atlanta region, which covers Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee, only 38% received a rating of A. Nationally, only 26% received the rating
Once
of
again,
A.
the Southeast,
Yeah.
on top.
We're on top, but I must say, I think and I think a lot of this is due to my
that
predecessor, Ms. Herbert, putting a lot of things in place within the office, but also some of the internal controls that we did as a city with leadership, being more accountable, looking at ways to streamline and make sure we're making good loans, and I think that has really accounted for our success here.
Chris, we got a whole agenda. You don't have to leave now.
This is good stuff. Won't see this in the paper, but but this is something we should be very proud of. Because we received the A rating before, we were required to report biannually, but now because we have this rating, we're only required to report annually. So that's very, very good. And again, I want to reiterate: it's not just the OBO staff is wonderful. Tanya is great. Our loan officers have been great. Our OBO staff is great. They're here today.
Hey, OBO staff.
They're really good. And I think all of us collectively, especially the Office of Finance, we have to depend on them to help make sure our numbers are right, our reports are done timely. And Jeff with his team, Jan and everyone, has been very instrumental in making sure that happens. So thanks, Jeff, for that.
It's easier to get a loan than it is to get reimbursed.
and listen, let me.
Yes,
can I-
sir.
can I ask?
Sure.
The number of loans that are in default, does putting teeth into this prevent some of those loans from going into default?
It does. What we're looking at, we're trying to look at that, and our loan officer is working aggressively with some of those loan applicants that we see maybe they're headed into that direction. We're trying to approach them quicker to see if we can do some modifications to help them out, to see where they are before they reach that period.
So there are several levels you do before
Correct.
it goes
Into default.
Before it goes into default.
Yes, sir. Yes, sir. And there's a lot of outreach that's done, not only by us, the OBO staff, but also by our loan servicing agency that sends out notifications when they're late. They're the ones that actually collect on our loans.
So once, just say for an example, a loan goes in default,
Yes, sir.
what's the process?
Well, first you get a letter, 30 days
sure,
out.
yeah.
You'll get a letter when you're late, 30 days. And if it's not rectified by then, our loan officer is also making calls at the same time. We're visiting, we're showing up there at your business, if it's still operational, let's hope it is, to see what the problem is. We're trying to develop that one-on-one relationship. Now, that 30-day window, we present every month to our Commercial Revolving Loan Fund Committee so that they're aware of what loans are out there and where loans are late, how far out are they, how severe are their delinquencies. 60 days, we're still doing the same we're more aggressively trying to reach them and see what the problems are and if we can make any modifications with their loans to get them back on track. 90 days, and they're still not being responsive. Unfortunately, we have had to seek legal action with them to be even more so aggressive in trying to get repayment of our loans. But I will say that since we've been here again, our loan officer, Brett Whiting, he's not here today, he's at a training. He's really good at sitting down with the different applicants and with our loan recipients and trying to address it. And if we see something happening, we try to put some things in place to stop it and prevent it. So we're trying to prevent those defaults.
So there is recovery after default, or
Yes, sir.
process.
Yes, sir.
That's my point.
Yes, sir.
It's very valuable. If a business with good intent defaults on a loan, what are the parameters we could set up to perhaps bring it back?
Correct.
I think his recovery and your recovery, two different words. You don't recovering your assets. He's talking about a firm recovery.
That's right.
He's talking about the recovery.
Oh, okay. Okay. You mean as far as when they default and the actual asset that was used as collateral for that loan? Yes, we're going to go after some. We are going to go after some property with our leadership's approval, of course.
Yeah, our experience has been, Councilman, that we work it very much so on behalf of the applicants and our partners, treat them as partners.
We do, and we really don't want to do that because they are a community, active community partner. And that's another provision that you're going to see here too, that I already mentioned. There's another way that we can actually buy out the first position on a loan. That means it will give us a greater chance of recovering the money on that loan. So that's another provision that has not been there in the past, that's there now. So that's where those days, the 18-month compared to a reasonable time frame is in place. So it depends on the project or each loan, but it is there. There's other things, other teeth that are there that gives us more of a chance to recover our money.
That's what I'm.
Yes, sir. Yes, sir. Did that answer your question?
Yes.
Okay.
Yes, ma'am.
So there's some buildings out there that we may not necessarily want, Teresa, but we may look at. And so just for instance, a hypothetical, say it's a mortuary or a funeral home. Don't go there?
Junkyard?
A junkyard, not a junkyard. But we're looking at ways to actually, if for instance, or if for whatever reason, we may have to sell that property, or we may want to look at utilizing that property at the city as an asset of the city, we're looking at doing environmentals on the front end to see what type of cost is involved and if it's a viable option for us to keep. Is it a viable option for us to make that type of investment if we're going to have to actually invest more money in order to, sell it or to use it in the future?
How many loans do we have outstanding?
Oh my goodness. In total, including ADA? 50? 50, Tanya, 50. Yeah. And again, we're going to have a more comprehensive review for you at a later date, but I really just wanted to touch base with the changes or the amendments regarding EDA and how those amendments will impact our CRLF code and what changes need to be made. But we will get that to you.
It would be certainly good to have that kind of information.
Yes, sir.
We know folk find themselves in crisis situations. My whole intent of asking the question is perhaps it's recoverable.
Yes, sir.
And can we do something to perhaps, whether it's a modification, whether it's this or whether, I think the end run is, if we need to secure, for lack of a better word, collateral, that sort of thing, when it's not happening, I think that's the last rung. But I'm glad to hear you say that there are some sequential steps.
There are.
Yeah.
And even my predecessor did the same thing. I think sometimes we see things at the end where you do not see all the steps that staff may have taken in order to try to work with that person. But we are trying to reach out and do even more communication and more hands-on and direct face-to-face meetings with our loan recipients so that they know we're here and we know that there's something going on. But if we can prevent something from getting further in default, it's easier to do those modifications and to save their assets before we proceed. But we do have to be better, we have to be good stewards of our resources. And a lot of that goes into this rating that you received of an A was because we are. We're holding our loan recipients accountable just as we are held accountable. And that's what our funders want to see as well. So I mentioned this because we did receive the A rating. Our next financial report will be based on our fiscal year end. So we just submitted our actual report September 30th for fiscal year ending June 30th. And our next one will not be due until next year. So looking at the actual proposed changes to our CRLF code, and I have that in front of you. You can actually look along if you would like. I have the code. I passed that out. I know that Erica probably has it as part of your packet this evening too. But I just wanted to share some of this with you just to go through it specifically. Again, section 8.28, it deals directly with what we did. We took out, we added public to make sure that it includes all or any federal, state, or local resources when it comes to that 2-to-1 public-private match or leverage requirement. Section 8.29, 8.2.9, we removed private to public dollar, private, and added the word leverage and non-RLF, and RLF in accordance with EDA amended regulations to include any federal, state, local sources of loans when combined with an EDA loan to meet the 2-to-1 leverage requirement. Again, 8.3.3, the same thing, remove private, again, to reflect the larger public resources that can be used as our leverage requirement. 8.7.2, minor corrections made here just to correctly reference our Community Development Block Grant, Community Economic Renaissance Fund, and our EDA fund. That's just a minor revision that was made. Now, section 8.8, we removed Assistant City Manager with some changes that our leadership has undergone here in the structure of the city. This gives Ms. Wilson, council, a better and more flexibility in making different appointments to the CRLF committee, but it also gives Ms. Wilson a chance to look at what other staff or departments may need to be involved and know what loans are being made out of OBO. So with this change, you have more flexibility. We added senior staff or administration member. So it could be an assistant city manager, it could be a senior, it could be a director, agent, a department head, it could be just a staff person, but it's someone that can contribute, that knows about economic development, that knows about other initiatives that are going on across the city, and they could bring that to the table when we're looking at different loans. Again, 8.10.3, just some minor corrections made here regarding the references to our different community revolving loan fund programs that we have. 8.14, again, removing the word private and replacing with other participating lenders so that we can look at other public sources of leverage that can be used to meet the 2-to-1 leverage requirement. 8.15.1, the same thing. Yes.
So on 18, when you capital, you go back to where you were, 18.1.
Mm-hmm.
It says cash available for lending. Would you need to add something in there? And let's just put a hypothetical out there that we fund a restaurant.
Mm-hmm.
They end up failing. We have the lien on the equipment. we're taking the equipment back. Can we use that equipment then, instead of selling it to replenish the loan, to put somebody else in business?
If it's part of the loan and if it's part of the collateral that we use as we enter the loan.
So my question is when you're replacing capital in here, do you need to add a line in there
We
that gives
could.
us the ability to
Cash
put an
available for
asset
lending or capital.
assets
Or asset, we
Yeah.
could do that. I used here, what we used was the specific language that was part of the regulation, but we certainly could make that modification.
Because I think there, no matter what the business is, I mean, we're loaning on a hard asset. It may be something that we can put out there to either enhance somebody's current business or help somebody else
That's a great
jumpstart.
point.
Yeah, that would be good, because I know there's some applicants that come in and they do have some challenges in terms of getting off the ground.
That could help.
Have a need for equipment if it's a restaurant. If we have it, then
A lot of times,
we can make
Yeah.
better use of it.
and if they've got capital to put in, but
Right.
yet they don't have to use that they could use that capital for working
Right.
cash flow, and we had an asset that may help, maybe worth. Just look at that language. It's just something that kind of popped in my head as I was reading through it.
Great point. Thank you. 8.18.1 C and 4. We're looking at, again, this was what I mentioned earlier about buying out the first position in a loan to help us, if it's an asset that we're trying to go after, to have full control over that asset. This is an option that we have, and that's one of the
If we-
changes.
Now, we're in second position most of the time.
Yes,
This
sir.
speaks to the, that's, okay.
Yes, sir.
Gotcha.
Yes, sir.
All right.
We are in second position most of the time, but in the event that
But you
there's,
want it bad enough.
we're about to foreclose on it, or someone's about to foreclose on it, we can go after the first position to secure that asset so that we can recover as much as money as
Easy.
possible.
Is that
Hand
new?
grenade.
This is new.
Throws a hand grenade and then leaves.
This is new. Any other questions?
Yeah, so, the other thing I was, in your, I think it's coming up on your next one, your next slide, where you say remove private commitment and use the word leverage, do we not just want to keep commitment versus leverage?
Leverage is a word that they actually use.
That's what they are
That's in the
recommending.
regulation.
Okay,
We could say leverage or commitment or commitment. I think they're one and the same, but leverage is actually what was used in the amendment.
okay. Thank you.
You're welcome. 8.18.5, again, removing the word private and adding language to reflect the additional public sources that can be used to meet the 2-to-1 leverage requirement. And then we also added language in accordance with the EDA regulations. Now, this is not new, but I went ahead and put it in here just so that's part of our code. Regulations that private investments shall not include accrued equity in a borrower's asset. I just thought that was important that we put that in there. So that's it right now.
So what do you need us to do, just adopt this? Is this on our, go ahead and
The
adopt it
first
tonight?
reading is tonight.
So what about the couple things, amendments?
We can do those amendments.
Can we do
We
that
can
on
it
the
during
second reading?
Yes, sir. We can do that. And I just want you to keep in mind that these proposed changes in this code will be reflected in our 5-year plan. That's also due to EDA. So that's why we're working simultaneously at the same time to get this done and make sure the CRLF committee is aware of what changes are needed so that when it's time, once you approve this and we have our second reading and it's finalized, then our plan will be finalized too at the same time. Any questions? Yes, sir.
That's a question. I assume the, under types of loans, under $10,000, is that what we consider
Which one are you looking at? Is that the?
page 2,
That's
on
under the definition.
the ordinance? Yeah, I think. That's what we would consider to be microloans?
Yes, sir. Yes, sir.
How are we doing in that area?
Right now, we have not done any since I've been in the position. I think the closest that we've come, and Tanya, you correct me if I'm wrong, in recent years was probably one in the amount of 15,000, but that wasn't done with any of our federal resources. I think that was part of our SURF loan, and it was for $15,200. So that was part of our SURF, our Columbia Economic Renaissance Fund. We have a little more flexibility with those dollars than we do with our federal dollars.
So we don't have any applicants in that category?
Not pending right now, but we are looking at other ways to do some additional microloans. Not just, we're trying to take it up to 50,000, so that we can help some businesses, especially some of our proteges, secure different equipment that they need or make emergency purchases that they need so that they can go after additional contracts. So that's something that we've talked about that we want to do in the future, but not at this moment. But they are available. We do have loans that they can get for 50,000 right now under these different umbrellas that we currently have in place, but they're not necessarily considered microloans. Any other questions?
Thank you.
Thank
Melissa.
you.
Thank you.
Thank you. We will entertain a motion, Mr. Mayor, for executive session with the addition of one item that you all should have on your amendments page that Erica
Y'all
provided.
done with these?
I like the limit, everybody else.
I'd like to make a motion to go into executive session for discussion of negotiations incident to propose contractual arrangement pursuant to 78-2 Employee Health Center Lower Richland Sewer Agreement Towing Contract, Soda City, the 1920 CDBG allocation, Alvin Glen Detention Center, and River Alliance. Discussion of matters related to proposed location or expansion of services to encourage location or expansion of industries or other businesses pursuant to 78-2 Jushi and parking. Receipt of legal advice relating to a pending, threatened, or potential claim pursuant to the SC Code. Tamika Price versus City, Lynn Robertson versus City, Clarence Campbell and Alice Campbell versus City. And receipt of legal advice of matters covered by attorney-client privilege pursuant to 78-2 zoning text amendment.
So moved.
All right,
No, second.
moving probably second.
It was
Discussion
my fault.
with the previous question, clerk call the roll.